Hey everyone, this is Dr. Kazi, and in this video we are going to learn about the bones and the osteology of the forearms. Now, your forearm or the antebrachium consists of two important bones, the radius bone and the ulnar bone. Have a look at this diagram. The radius bone is present on the lateral side and the ulnar bone is present on the medial side. Now, let's discuss these bones one by one. The radius bone will consist of the proximal region, the body or the shaft, and the distal extremity. The proximal region consists of the head, neck, and the tuberosity. The head will articulate with the radial notch of the ulna. Below the head we have the neck and the tuberosity. This tuberosity is the rounded elevation. It is the attachment side of the biceps brachii muscle. Now, have a look at the body or the shaft. On the medial side of this radius bone we have the interosseous border. This interosseous border will contain the interosseous membrane. The distal extremity consists of the styloid process and the ulnar notch. This ulnar notch will articulate with the head of the ulnar bone. Now, have a look at the ulnar bone. Remember, the head of the ulnar bone is present close to the wrist joints, and the head of the radius bone is present close to the elbow joint. So these are opposite. The head will articulate with the ulnar notch of the radius bone. The proximal region consists of the olecranon process, the coronoid process, and the radial notch. Between the olecranon process and the coronoid process, we have a notch which is known as the trochlear notch. This trochlear notch will articulate with the humerus bone. Now, on the lateral side, we have the radial notch of the ulna. This radial notch will make a joint with the head of the radius bone. Now, let's see how these bones articulate with one another and with the elbow and the wrist joints. Have a look. We know that on the lateral side, we have the radius bone, and ulnar bone is present on the medial side. Now, proximally, the radius bone will articulate with the capitulum, this spherical portion of the humerus bone, and also with the radial notch which is present on the ulnar bone. Again, the radius bone proximally is making a joint with the capitulum of the humerus bone and the radial notch of the ulnar bone. Distally, the radius bone is articulating with two carpal bones, the lunate bone and the scaphoid bones, and also with the head of the radius bone through the ulnar notch present on the radius bone. Now, have a look at the ulnar bone. The ulnar bone is forming an important joint with the trochlear of the humerus bone, and it is through the trochlear notch of the ulnar bone. Distally, it will articulate with the ulnar notch of the radius bone. Now, remember, the ulnar bone is not included in your wrist joint. An articular disc is present between the head of the ulna and the wrist bones. Now, there is very important action which is known as the supination and the pronation. Supination is when your palm is facing anteriorly, and pronation is when your palm is facing posteriorly. During supination and pronation, the head of the radius bone will rotate on the capitulum which is present on the humerus bone. So during this action, the supination and the pronation, the head of this radius bone is rotating on this spherical structure which is known as the capitulum. In the next video, we are going to learn about the clinicals of these bones. Please do like, share and subscribe, and I will see you in the next video.